On October 5th, the Wisconsin Department of Health Services announced they have once again expanded eligibility for the monkeypox vaccine in the state of Wisconsin. The update comes after some updated guidance from the Centers for Disease Control. The expanded eligibility means more people who may be at risk of contracting the disease can get vaccinated. Wisconsin's Department of Health Services says making the vaccine available to more people is a critical step to preventing further spread of the disease, and they encourage anybody who is eligible to get vaccinated as soon as possible. Now, the eligibility in the state of Wisconsin was already for people that were in contact with somebody who had contracted monkeypox. There's contact tracing, risk exposure assessment, and other measures by public health departments that were making this information known. There's presumed contacts where you might have been at an event where someone later was determined to have tested positive for monkeypox, or you're at an elevated risk of exposure, maybe because you work in a testing facility, for example. The state gave examples of each of these scenarios in their press release and in their guidance, and we link to that in the description below. They've added more categories of eligibility, and the first one is you have a diagnosis of a nationally reportable sexually transmitted disease like acute HIV. If that is the case, you are encouraged to get vaccinated against monkeypox. They also expand that potential risk. Maybe you are going to an event in the future where exposure is likely. That is enough to make you eligible for the monkeypox vaccine. As of October 5th, the Department of Health Services says there are about 81 cases of monkeypox that have been identified in the state of Wisconsin. The rate of new cases does continue to decline, but the risk remains, and that's why the department is doing a push for more vaccinations. And they say most cases are in men. There are also people of color that are being impacted disproportionately, and the communities of color are not getting vaccinated at a high enough rate. The Department of Health Services encourages anyone who develops a new or unexplained rash or sores to contact a doctor or primary care provider immediately. If you don't have a primary care provider, they suggest you call 211 and get some instructions of how to proceed. There are now approximately 80 sites giving the monkeypox vaccine in the state of Wisconsin. We link to how to find a site close to you along with this updated guidance from the state of Wisconsin.